This is Good Morning San Diego.
The start of the school year for kids across the country, whether it is elementary school, high school kids, even the college kids we were talking about yesterday. So we're seeing a lot more anxiety in our kids. But what about parents? Are we also stressed? When we come back, we'll talk to Dr. Mark Menelacino about how adults may be contributing to our kids' stress.
Just Dr. Mark to you and me.
He is. Welcome back to Good Morning San Diego. It is 7:47, and a disturbing statistic from the National Institute of Mental Health claims that 1 in 8 children are being affected by anxiety disorders, and parents are part of the problem for some of those disorders. So joining us to talk about that issue is Dr. Mark Menelacino from the Meno Clinic Center for Functional Medicine. We call you Dr. Mark because it's a lot easier. Good morning. Thank you for being here. This is really important because we as a society are just so busy, on the go. We're seeing more households with both parents working. Yes. So we want to make sure that we're managing our stress levels because studies have shown us that it's not good for our health. So I see you have an example of 2 kids here. Tell us about this.
Well, you know, Lauren, kids really model our behavior and they take their cues from us. And one thing we need to do as a family is we need to demand more downtime for our family. Let's help find ways to make it easier for the family to spend time together and not succumb to the overscheduling that we all do. We've got to pump the brakes as parents and try to help teach our kids these boundaries and try to make some choices that help to reduce this stress, to reduce this burden of anxiety that you talked about. It is everywhere. Yeah. And they really model our behavior.
So we're looking at Jenny and John here, who I think, you know, really a lot of parents can relate to this. Yes. You know, 2 days a week you're taking swim lessons, 3 days a week you're doing debate team. I mean, this is pretty standard of a lot of the kids, especially the high school age kids.
Yes.
That are trying to get into college, and we're just seeing them having to do more and more. So how do we help them appreciate downtime? How do we find that balance as parents to help guide them and learn to manage stress levels?
Well, a great way to do it is just as we've shown here, is make a whiteboard, sit down as a family and have family time and list out what everybody's doing. And once you see it in black and white, you realize really how much they are doing.
A lot, yeah.
We are overscheduling ourselves and our children. So decide as a family what one event to take out. And that provides the space to allow for the downtime so we can spend time as a family, do just basic play, not have to have this routine where we're super scheduled before school, after school, into the evening. And you're right, there's so much that's going on with kids, but they really see how we respond, and it's behavior we can teach.
And so our stress level really does translate down and trickle down to our kids.
It does. And it shows up differently in kids. They don't have the words to express how they feel when they're anxious. So you'll see it as physical symptoms like stomach aches or headaches. You'll see it as social withdrawal. You'll see these different changes in their sleep. You'll see irritability. So they can't express this anxious feeling, but you'll see these physical cues before you see the actual anxiety manifest.
Okay, so those are some of the symptoms that we want to look out for. And I know oftentimes we try to mask the symptoms. We take them to the doctor, oh, they're complaining of a lot of stomach, and then the doctor prescribes a medicine. So I know this is your area of expertise as well. So we're talking about some of these medications that might be prescribed that maybe aren't the answer, you're saying.
I did a master's degree in clinical trials looking at mood and anxiety medicines for kids, and I walked away thinking they don't work that well, and there are all kinds of side effects. The problem is a lot of what we're used to using have toxic ingredients in it. I'm fortunate to have joined a local California company. It was 2 dads that looked for a cleaner, organic solution for their kids. It wasn't out there. So they spent years developing it. It's Genexa, and in my clinic I recommend Genexa Stress Relief and Genexa Calm Keeper. They're safe for age 3 and up. It's a chewable tablet, but it's organic, non-GMO'd, clean medication. All of the other medications out there are pink. They have colorings in them, the preservatives, the dyes, there's gluten in them. They just have all these other chemicals. So I'd recommend go home, open up your medicine cabinet, turn over the bottles, and look at the other ingredients. That's where they hide a lot of these chemicals.
Right.
And toxic load on children may be contributing to this enhanced stress response causing anxiety.
Okay. And before we run out of time, I want to talk about really even better than that is food as medicine. So we want to make sure that, and there are certain foods that can
Absolutely.
actually help reduce stress levels. So give us an example of some of those.
One thing that really helps with the stress response is keeping your blood sugar even. And as
Right.
parents, if we can make it easy for ourselves, like pre-packaged carrots and celery so they get that stress-reducing crunch, add a little nut butter so you get some protein into that stress-reducing crunch. This is an easy way for us to get it pre-packaged and deliver it to our kids without having to be extra work on the parents. Chocolate has some of the mood-relaxing serotonin in it. It can be a nice treat in small quantities. You also have things like bananas, avocados, high in potassium, high in magnesium, the calming minerals that help to relax the body.
Great advice, and as we're all heading back to school, I think it's really important for us all to remember our kids, especially to dealing with those stress levels.
Yes,
so,
absolutely.
Dr. Mark, it's always good to see you. Thank you so much for great advice this morning.
Thank you.
We will take a quick break and be back with much more on Good Morning San Diego. Stay with us.